Hello everyone, Jose of Your Fish Keeping. Coming to do another reaction to somebody else's video, which I had said that I was not going to do anymore, and I actually made a video that maybe I had a lesson judgment about bringing up a certain topic. I did a Spanish version of this thing also regarding the father fish and the dirted tank method, and the natural, again natural with no water changes, no anything, no filters, again the extreme as I said. And you find out that people are very passionate what they do in fish keeping. Everybody has their own ways. We have this Spanish speaking group. There's about 50 of us, Spanish speaking country. This guy, he's a pediatric surgeon in Mexico. He says, you know, there's always comes a little expert with his little book. You know, in essence, everybody has their theories and their ways. So this video is regarding Sean from Discus North. He did a video this morning, and it's about quarantine is overrated and the most hyped up topic in fish keeping. He said a few things that I don't agree with him necessarily. I actually called him and I said, listen, Sean, I am going to do a reaction video too. It's nothing personal. I know where he stands, and he knows where I stand as far as the quarantine method. But I'm just going to tell you what I disagree with, because one of the things that I said before is that as fish keepers, especially, I try to guide most of my videos towards newer people. And if they hear from Sean that you should not quarantine, there are some qualifiers also, which I'm going to bring up. But if you say you should not quarantine, or you should do this extreme, again, this extreme is what I oppose to and comment. I may offend a few people who are in this. I actually did a couple of videos when I often talk about quarantining. There's a place for everything, of course. I have a very strong quarantine routine, and I'll tell you why. The fact that I am a nurse for 42 years now almost. There's some medical background which which I do certain things based on my own knowledge of medicine and also my own experiences. I've been a fish keeper for over 50 years. I've kept this since mid 80s, and I bred them at home as a hobby, never as for profit. And one of the things that he says is that it is highly overrated, that when you buy a fish, you should know what you're buying, because if the fish looks sick, you just don't buy it. True. Most of the times you look at a fish, I like to buy discus when I buy them at a local place where I can actually see it and I can observe it for a while. I don't tell people feed them for me to make sure they're eating, because when they all come up to you, they're expecting to be fed. I say, these guys are used to eating. So I generally don't ask people to feed them for me. And when I take them home, they eat anything. So they're really not as finicky as most people would say. Now, I can tell you, before I get into him, let me give you a real example that happened to me, as a matter of fact, yesterday. I bought a discus last week. I think I had them less than a week. There's this particular discus, which I'll put up on screen there. When you see it, you'll come up. It's called a red checkerboard. It's mostly a white background, and it has some fine lines. And I have been looking for this fish at least for a year. I have seen it in this particular store. At the time that I saw what I liked, I didn't have a quarantine space. I kind of let it go. There's a specific pattern. Some of them will have more white in it. Some of them were this. So I found one that had the pattern that I liked. So I came back the next day hoping that I would find it again, and it was still there. Only when I got there in this small tank, you know, in most fish stores, fish are severely overstocked in one tank because they move them around, they do frequent water changes or whatever the routine is. So there's about, one of them was lying on a corner. 6 of them were gasping for air, and I told the owner, hey John, take a look at this fish, there's a problem here. So he ran quickly, emptied the water down to, they were all flat at the bottom, and then did a complete water change. So obviously I could say there was ammonia levels there. And this store had been closed for about a day because it was a Chinese New Year. So probably water changes were not done that day. They do daily water changes. So I could guess without testing that this was an ammonia issue. So he does the water change. I looked at them, then they were all swimming. They were not gasping anymore. Out of impulse buy, because I was looking for this particular pattern and color, I bought the fish. With my better sense, I didn't follow my own instinct. And I said, you know what, maybe he was stressed out. Maybe he'll do okay. It was a he. Again, I don't buy sex, I buy the color. So I took him home. When I took him home, he was hanging around the tub, not gasping. He was on a corner. He was not swimming around. I used a 20-gallon tank to quarantine discus. I disagree with him as far as the size and so on for quarantining. I disagree with Sean. So the fish was fine for about a week. I never saw him eating. So I said, I know this discus was not going to do well. Again, my error for buying an impulse, because more than one time I saw the fish that I wanted and for whatever reason I could not buy. So I went back the next day, bought them knowing that there was a problem. So the fish, I found them dead yesterday. Okay, getting back to the topic at hand. He says that extremely overrated. You should look at a fish, you know the fish is fine, you buy it. But I can tell you something, a lot of the times you will buy a fish that looks absolutely perfect and it's gonna be carrying Trojan horse. If you don't know what the reference is, Google it, what a Trojan horse is. Maybe the younger people may or may not know. And he may bring in a hidden problem. Once in all my years, one discus that was very healthy looking passed a tapeworm. That was that, but I quarantine, I follow a quarantine process. I like to quarantine between 4 to 6 weeks. My routine, why, I will tell you in a second why I like to quarantine. Yes, a fish may look absolutely healthy. I had two other fishes a few months back that two of them passed in quarantine. I had 3 of them that I bought together. I could probably guess that they may have been high ammonia levels because I'm treating them, not enough bacteria, not enough beneficial bacteria there. So probably I missed adding prime for a day or two because I was in between treatments. And probably it may have been that. It may have been a bunch of other things, aeration. I actually cover the topics, the possibility why I think these 2 fish may have passed. One passed, then suddenly, like some discus sometimes, they're fine, and then they're gone, like in a minute. They do dart around and then they're gone. And then the other one was a little slower. I said, this one is gonna die too. I mean, one did fine, the other 2 did not. He says that if a fish die, it's not because of any illness or any bacteria. I consider Sean a friend. I never met him, but through YouTube, we've spoken a lot, and I consider him a friend. You know, we, as you know, in this hobby, we have friends all over the world, and we become almost like a tight family. But I can disagree with him. He can disagree with me, and that's fine. This is part of the hobby, but we can respectfully discuss differences, which is not what happened during the Mexicali fiasco and the whole father fish method. I disagree with a lot of the things that Father Fish says as far as the extreme. You have other people who say, oh, this is a Father Fish method, but then they have a strong FX6 filter. They have sponge filters on top of that, as the same as Father Fish did, and they do an aeration and do water changes. So you're not really subscribing fully to one method. You're adapting part of it to a way, right? For example. So then we're going back to this thing with quarantining. He says that fish get stressed out. They are definitely schooling fish. I have quarantined 3 in a 20, which is okay. And then they have this hierarchy. One starts bullying the other. That causes stress. So what I do is I separate them 1 per tank. And then sometimes later I put them back in and then they're fine. A fish for 6 weeks I don't believe is going to be stressed out. And because it's a schooling fish, because I don't know how many discus I have quarantined and have kept over the years and how many I have purchased. My current stocking, I have, I think, 28 discus right now in a 120-gallon tank. I do weekly water changes at 80%. Sometimes I do it twice a week if I feel like it. And whenever I have had fish die, my ammonia, I can say I've never had problems with nitrates. Ammonia levels I may have if I'm doing treatments to the whole tank because there is an illness. I treat it. You're going to affect beneficial bacteria by some antibiotics, and you may have a spike in ammonia levels. But if I'm using prime throughout it every 48 hours, so although the ammonia shows positive, it's another nitrogen compound that will give you positive on that test, but it's not the ammonia that is harmful to the fish. I've done a lot of in-fish cycling where I use this process. I use prime, stability, again, my choice to use CChem. You can use whatever you like, but although the ammonia levels say high based on the test, I have not lost fish during quarantine. Twice I've lost a fish during quarantine. Why? This fish was probably sensitive to one of the medications. Which one, I don't know, and that was the golden nugget pleco. I lost 2 of them during quarantine. Others I did not lose, but those 2 maybe they were just weak. But again, so when I do get any of them, I don't treat them the same. I quarantine them differently. I don't medicate the same way. I suspect that one of 3 medications that I use in a trio together, maybe one of them, which one, I don't know. So I don't use that one. I just observe them for a little bit longer. So he says 20 tank, they're going to get stressed out. I don't think so. They may be more stressed out by putting into a situation, putting into a tank where they may be already sick or harboring something that we don't know about. So when he says if your fish die, it's not because of disease in a tank, in a community tank, it's because of high ammonia level. I generally don't have ammonia level. I have never had high nitrate level, as I said, because of plants, and I just been lucky, I guess, right? So I disagree with that point that if fish die in a tank is because high ammonia level. Sometimes fish will show a sign of disease. I separate them, I treat them, or I observe for a day. If they're still not looking too hot, I remove them and treat them, and then put them back in the tank after treatment, and they're fine. And they've been like that for years, let's say. So that's the other thing that I don't agree with him totally. Now, let me tell you a real example of what happened with me. I follow this quarantine process probably about 4 years ago. I got some probably 20, 30 rummy nose. I got them online. They all looked wonderful when they came in. So I quarantined for about 3 weeks. I violated my own rules, and I put them in the discus tank because I just wanted to see the huge pool swimming back and forth. So what happened was that one fish started coming out with hole in the head, which discus sometimes get. And then a lot of the fish had signs of columnaris, very clear signs of columnaris if you look it up what it is. So one discus got something, the other one, and then the other fish started showing the saddle back, and they were all the classic signs of columnaris. If you know columnaris, it can wipe out a whole tank within 24 hours. So every day I was coming home to 4 and 5 dead discus. I had about 20 at the time. That was the most painful thing that I have gone through in fish keeping. I think it was more painful for my wife, because my daughter was probably 6 at the time. She would say, "Oh my God, another discus died," and the whole tank, except one remaining gold gourami that is remaining, everything died in that tank. I had to nuke the whole tank and start all over. Plus, I lost about 50% of the other fish in the tank. So I would estimate that discus tank, I lost between $4,000 to $5,000 in fish alone. So other than the emotional pain of seeing all your fish die, and the money, yeah, bothers you. You know, you do it slowly. You build up your stock slowly. So it's taken me about over 3 years to build the current stock. So do I quarantine fish? Am I excessive? Hey, hell yeah, I am. I don't want to go through that again. And I can tell you that in my field, you can have people. I've always been a critical care nurse. I'm an emergency room nurse. During the height of the pandemic of COVID, I'm talking about, I can tell you that I bagged many people per day, right? It was an extreme. When I found out, I was working in an emergency room and then in an ICU, intensive care unit, in another place, and we had the sickest people in this particular ICU. 30 of the 35 operating room in this place were converted to ICU. We had 3 or 4 patients in there. When I had COVID, I was actually very early on in March of when the worst stuff was worse. I was actually happy, and I had a oh yes moment when I found out it was actually positive, because I was a prime suspect, Hispanic, my age, diabetes. I had all the right comorbidities to be dead with COVID or to have COVID in a strong way. So when I just had some symptoms that were not extreme and did not need to be hospitalized, I was happy, because I said, if this is all I'm getting, then I've dodged the bullet, right? Almost literally. I can tell you that after preventive measures were done, what preventive measures were those? Vaccine, the anti-vax people, that's fine. I'm in another position. So all the anti-vax people, I can tell you that once vaccines started happening, the people that were coming into the hospital that were positive with COVID were the people, and who did not need to be hospitalized were the people who were vaccinated. Again, you don't have to agree with me. I'm just telling you what I saw every day of my life, because I worked 2 jobs. I was 6 days a week, sometimes 14 days straight, 21 days straight in a hospital. So this is what I saw every day of my life. So you don't have to agree with me. It can be your opinion, but I can tell you the reality of what happened and what I lived through. So people that took prevention, treatment, quarantine, let's say for example, mask, you don't agree with the mask, then find mask. That's kind of a quarantining process. People who came in with COVID, you have to go home. We're not going to do anything because you're positive for COVID. You have a sore throat, you have this, you have that. Go home, it'll pass, right? You're already vaccinated. You already have the illness at the moment. So we send home. But do you know how many people we got in there who let's say you came in for a broken leg or you had a car accident. Oh, by the way, you're positive for COVID, right? Now, you were taking care of that patient the whole day until you got results back, either for that. In my 41 plus years, you know how many times I've taken care of patients who weeks later they came back. Oh, by the way, that patient had meningitis, that patient had tuberculosis, which are potentially a deadly disease. So now they put you on preventive treatment because you were exposed to that patient. Now, we didn't know. That was a Trojan horse right there. So the patient looked okay because he came with a broken leg, but then later tested positive for something else. Now, are we going to treat everybody, every patient that comes in for a disease that they may have? No, we don't. But in a situation where you have fish that potentially the overcrowded conditions with breeders and whatever conditions you think they can bring potentially something to your fish room, to your tank, that can possibly kill everybody. And it's not going to show until much later. You get a parasite that the fish looks totally healthy, but then months later the fish is losing weight, like in this case they lose weight. It's very hard to get them back. It could have been other factors, but maybe he had a parasite that you never knew about, right? Possibly infected others. You don't know that. So I don't take a chance with those, with quarantining. You can do whatever you like, but it will be common sense. You quarantine however you want to do it. You know, in my professional career, how many times I have been in a situation where we may get a person who looks totally fine, and then suddenly, you know, somebody, they're going to cardiac arrest. They look fine on the surface, but we really don't know, especially now in animals, in fish, we don't necessarily test them or do a physical or something to know if they're carrying something. So, you know, my point about this whole thing is you don't have to medicate fish, but you should really be cautious because they could be carrying something that you don't know about. I have had multiple times where I have had people, non-medical people, they say, oh, I just saw that person talking 5 minutes ago. They didn't know the whole story because they sort of seem okay on the surface, or they'll come in because maybe they're having a headache, or maybe they're having something that they think is mild, or put it off, and then suddenly, you know, the person is no longer with us. So again, I'm not being an extremist here, but the point is that you have to do things. Of course, your own experience tells you what will work for you, and you know what you should do. I'm not saying medicate. I just choose to for the reasons that I've already explained. But it's an individual basis. If you buy 2 or 3 ruminoses, you know, are you going to spend a lot of money trying to fix them? Maybe not. And sometimes we do take chances. I have taken chances on fish and have done okay. But again, that's a very personal thing, and how you manage it, you know, it's your own. There are 2 camps in fish keeping. I don't quarantine. Why am I going to treat for something that maybe they may have? Well, you don't know that. But I don't want to take a chance on the maybe they may not have it, because maybe they may have it. It's a bigger possibility in my books. You may have been lucky all that time, but there may be a time where you're going to take that chance, and you may pay dearly, as I did. Again, your experiences are different than mine. Fish keeping is do it your way, whatever works for you. Now, just to get back to, I was ready to come down with the hammer and tell Sean, hey Sean, what the F are you talking about here? He did fix some things, and he says, that if you get 20 ruminoses or 20 or something, you may take a chance because maybe one of the fish is sick. You don't know that. That is the whole thing. You really don't know that. So again, with me paying for one disc is $300, for example, $250. Mine are always large, the ones that I buy. So they range at, you know, average $200. Am I going to take a chance for not treating medications, not treating fish for a little bit, those that will be joining the rest of the gang in there? And my tanks are overstocked, so that alone is a risk for stressing them and having illness. I've been lucky since I started taking precautions. My discus generally don't get, don't go to extremes of illness. Do I have one that dies occasionally? That happens. Humans die with medications, with treatments, with everything. That happens. That's part of life. Whatever causes death, it will happen for sure. Will some fish die because of carelessness in my end, because of not wanting to do something, because this is what I strongly believe? I try to avoid that because it's not a fun thing to go through. If you have not gone through that and you don't wish it on anybody. And I'm sure there are many fish keepers out there that will agree with me that have gone through a similar situation. You just need to be cautious. And however you quarantine, it's fine. If you quarantine but don't medicate, that's fine too. You do it your way. They're your fish. It's your home. It's your fish tanks, right? Hobby, do it your way. Like Burger King used to say, have it your way. Sean likes to call it the swamp tank group. I don't disagree with the dirty method thing at all. Dirt has its place. Plants like the dirt generally, so that is fine. But to say I'm going to keep fish, especially discus, in a tank that I'm never going to do water changes, that I'm not going to filter, that I'm not going to have any air movement. Again, those are extremes for me. You can take part of Father Fish's method, use the dirty tank, but if you're using a filter, if you're using aeration, then it's not going 100% with what he's preaching. And you can take part of thing, whatever works for you, it's fine. I don't have anything against anybody, anything against extremes. But when you say this is the way things have to be done, or you are full of shit if you do this or do it that way, we can disagree and be respectful at the same time and respect everybody's ways. That's the way it is. There are family members of mine who don't speak to me sometimes for months or for years or for weeks, and you say, what the heck happened? What did I do? Then when you kind of look into it, I said, that's what bothered that person, that I didn't call her or didn't call him to say, hey, are you okay? Or something like that, and it's like, this person is pissed off with me for weeks or months and you don't even know why. We can disagree. You don't have to agree with what we say. We're humans, we're different, we're unique. And the same thing for fish keepers. And I said, you know what, I don't discuss religion, I don't discuss politics, and I said, I don't discuss differences in fish keeping. But again, these discussions are healthy, I believe, because you have new people coming in, and I feel that as YouTubers, we do have a responsibility to put information out there that is hopefully truthful to new people coming in. Because if you have somebody that comes in that said, no, the only way to keep a fish is the natural method, or the only way to keep fish is by not quarantining at all because everybody's full of shit, then that's kind of, I think, putting information out there that is not totally correct. Sean, I respect you, and I had this conversation with you before that I was going to do this video, but if I see something that is kind of an extreme thing, he has very strong opinions, and I don't agree with everything that Sean says, but I respect his method. I've taken opinions of him on other things, but again, it's we have differences, and you have to do things whatever works for you and whatever works for your fish, which is even a better way of saying. So again, your opinions are your own. This is my opinion, he has his opinion. So hopefully we can continue a healthy conversation. And thank you so much for listening to me have a little bit of a rant, I guess, if you want to call it that. Thank you so much.